The science behind antiperspirants, understanding how they work and their impact on hyperhidrosis management. If you're part of the always sweating community, finding an effective solution is essential. Antiperspirants play a crucial role in managing excessive sweating, offering both temporary relief and long-term benefits when used correctly. Hyperhidrosis can significantly impact daily life, but understanding how antiperspirants function allows individuals to make informed choices that align with their needs and lifestyle preferences. What are antiperspirants? Antiperspirants are topical products designed to reduce sweat production by blocking pores through which sweat reaches the skin's surface. Unlike deodorants, which primarily mask odors, antiperspirants target the root cause, excessive perspiration itself. These products contain active ingredients such as aluminum chloride hexahydrate, which temporarily blocks sweat glands. When applied regularly, they form a gel-like plug within the ducts, minimizing moisture release during normal activities. Active ingredients: aluminum compounds work by creating a barrier inside sweat ducts, preventing liquid from escaping onto the skin. Application technique: proper application involves applying the product at night while skin is dry, allowing it time to settle before morning activity begins. Maintaining consistent usage ensures optimal results. However, overuse may lead to irritation or reduced effectiveness due to buildup around gland openings. Types of antiperspirants available today: modern formulations cater specifically to those experiencing hyperhidrosis conditions, offering various strengths suitable for different levels of severity. Over-the-counter options typically contain lower concentrations of aluminum salts compared to prescription-strength alternatives. Certain brands have developed specialized versions targeted toward areas prone to heavy perspiration, including feet, palms, underarms, and even facial regions affected by localized sweating disorders. Prescription antiperspirants often feature higher potency formulas administered via medical supervision, ensuring safety without compromising efficacy against severe cases requiring stronger intervention measures. Differences between OTC and prescription options: over-the-counter varieties usually provide mild protection sufficient for light to moderate sweating episodes. However, individuals suffering from generalized or focal hyperhidrosis might find these insufficient unless combined with other treatments. Medical professionals prescribe stronger solutions containing increased percentages of active agents, sometimes reaching up to 20% concentration levels. These concentrated mixtures require careful handling and precise dosing guidelines established by dermatologists or primary care physicians. Insurance coverage frequently influences accessibility, since many health plans cover prescription-only items, whereas store-bought selections remain out-of-pocket expenses subject to personal budget constraints. How do antiperspirants affect sweat glands functionally? Sweat glands operate continuously beneath our skin surfaces regardless of environmental stimuli. The mechanism behind antiperspirant action lies within its ability to interfere physically rather than chemically alter bodily functions related to thermoregulation processes. When exposed to air after absorption into epidermal layers, certain components crystallize, forming microscopic barriers across apocrine and eccrine glands responsible for producing moist secretions associated with profuse perspiration patterns observed among sufferers. This physical obstruction prevents fluid passage until natural exfoliation cycles gradually remove residual deposits, thereby restoring full functionality, albeit temporarily, until reapplication occurs. The duration between applications varies depending upon individual physiology factors influencing rate at which old plugs disintegrate naturally versus new ones being formed following subsequent uses. Efficacy studies and clinical evidence supporting use. Scientific research has consistently demonstrated significant reductions in sweat output achieved through regular use of properly formulated antiperspirant products. Numerous controlled trials indicate success rates exceeding 70% amongst participants utilizing recommended protocols twice weekly. A longitudinal study published recently examined responses from patients undergoing treatment regimens involving nightly applications alongside adjunct therapies. Results showed marked improvements reported by 93% of subjects who adhered strictly to prescribed routines. While some debate persists regarding potential systemic effects resulting from prolonged expo, moreover, comparative analyses highlight superior performance metrics displayed by newer generations incorporating microencapsulation technologies, enhancing penetration capabilities beyond traditional delivery systems previously available only through clinical channels. Potential side effects and safety considerations. Despite widespread acceptance within mainstream populations, concerns occasionally arise concerning possible adverse reactions linked primarily to frequent or improper utilization techniques. Common side effects include contact dermatitis manifesting as redness, swelling, itchiness localized mainly where applied substances reside. To minimize risks, users must adhere strictly to label directions specifying frequency intervals, quantities required for each session, along with warnings, cautionary notes about contraindications, existing prior administration steps. In rare instances, particularly affecting sensitive dermal tissues located near delicate anatomical structures such as eyelids, brows, nose tips, etc., allergic responses could develop, necessitating immediate discontinuation, coupled professional consultation, seeking alternative remedies. Vigilance remains paramount, especially considering recent findings indicating elevated incidence rates correlated with habitual overapplication practices common amongst persons struggling chronically against persistent humidity issues. Alternatives and complementary treatments for those unresponsive to standard antiperspirant interventions. Exploring supplementary methods proves beneficial towards achieving desired outcomes. Botulinum toxin injections represent one viable option, delivering long-lasting suppression effects lasting several months post-administration. Iontophoresis devices offer non-invasive procedures employing electrical currents safely passed through water mediums, inducing transient blockade mechanisms similar yet distinct from conventional chemical approaches utilized extensively thus far. Lifestyle modifications constitute another fundamental aspect, contributing positively towards overall management strategies. Simple adjustments encompass wearing breathable fabrics, avoiding spicy foods, maintaining balanced hydration statuses, all playing critical roles mitigating exacerbation triggers. Additionally, surgical interventions become consideration points reserved exclusively for extreme scenarios wherein conservative modalities fail altogether despite exhaustive attempts made thereto. Navigating product selection. Choosing the right antiperspirant for you. Selecting appropriate formulation requires assessing personal circumstances, thoroughly taking note particular body parts, involved level, intensity, experienced frequency, recurrence patterns exhibited daily, living situations encountered routinely. Consulting healthcare providers serves invaluable purpose, guiding selection process, appropriately matching recommendations, closely aligned patient profiles, maximizing therapeutic gains, simultaneously reducing unnecessary expenditures incurred otherwise. Beyond mere composition elements, evaluating packaging designs, convenience, features, ease, accessibilities also factor importantly, determining satisfaction derived therefrom, ultimately dictating adherence, likelihood, sustained benefit attainment. Lastly, recognizing importance, education surrounding proper technique. Execution guarantees successful implementation, ensuring maximal utility extracted every single application performed accordingly. Conclusion: understanding the science and practicality of antiperspirants empowers individuals dealing with hyperhidrosis to manage symptoms effectively. With the right knowledge and approach, controlling excessive sweating becomes achievable and sustainable. By selecting the appropriate type of antiperspirant based on personal needs and consulting healthcare professionals when necessary, anyone can take control of their condition and enjoy improved quality of life free from the burdens of constant perspiration.